Hello, I'm Dr. Vikas Agarwal, ENT Surgeon with interest in sinus and snoring surgeries, and I'm attached to Jaslok Hospital and Speciality ENT Hospital, Mumbai. So, according to a recent study conducted by All India Institute of Medical Sciences, New Delhi, around 100 million Indians are suffering from sleep apnea. That's a staggering 10 crores. So, these people are having disturbance in their sleep, and on account of that, they choke every night more than 10 times, 15 times per hour, and that leads to productivity problem, that leads to heart attacks, sudden deaths, and they're not being able to deliver during their work, and that's also a leading cause of traffic accidents. So you can imagine how big is the economic impact of this problem. 10 crore people suffering with sleep apnea, leading to health issues and traffic accidents. Now, if we come to sinus problems, almost half of the world's population is having a deviated septum of some grade. Around 1/4 of the world's population is having some kind of allergy. So, if we put it together, almost 2/3 of the population has some kind of disturbance in the breathing, which leads to fatigue, not getting up fresh, not being able to deliver at their workplaces as they can do. And you can imagine the amount of economic loss to the whole economy by their decreased productivity, not being able to perform to their abilities. The treatment options for kids and young adults are majority surgical because they are good candidates for surgery. We find out where is the problem and then we can correct them surgically. But for old people, the continuous pressure airway device, CPAP, is a very good alternative, and in some cases we also use mandibular advancement device that gives a good control of the disease, if not cure, but that's a very good control, and that at least keeps the disease process under control and they can perform and they are saved from complications. So the continuous positive airway pressure device, or the CPAP device, is a gold standard for treatment of sleep apnea in adults across the globe because it takes care of blockage at all the levels in the airway, whereas surgery is generally done or preferred for younger adults and children, where we define exactly where is the blockage by performing, say, sleep endoscopy or different tests, and then we can take away the blockage by a one-time surgery which is minimally invasive. So it's generally reserved for younger adults and children, but for older adults and old people, CPAP device is definitely a very good choice. So as I said earlier, in children and younger adults, the lifespan is pretty long, and therefore we are looking at cure and not mere control. So in those cases, we figure out where is the blockage by performing drug-induced sleep endoscopy, which is we put a small endoscope through the nose of the patient and make the person go off to sleep and snore, and that time we see where is the blockage. That's called drug-induced sleep endoscopy, to figure out where is the problem. And then once we figure out where is the problem, then we remove that blockage by a technology called coblation technology. It's a cold ablation technology, so it does not burn the tissue. There's no bleeding, it's painless, and it only melts the tissues. Therefore we can remove the tonsils and adenoids of a small child without a drop of blood, without any pain, or we can reduce the size of the soft palate of an adult by using this technology. And for more difficult cases, we also use the robotic surgery technology, where, say, at the base of the tongue or the back of the tongue, if that part is enlarged, we use the robot, surgical robot, the Da Vinci, to remove the part of the tongue which is large. And these technologies are minimally invasive and they make the procedure very safe, and they are available in this country for more than 10 years now. In fact, we did the first robotic surgery in this country in 2012. So definitely technology has a little cost, but it is available because it's not costly than life of some patient. So as we have seen that sleep apnea is a major cause of morbidity and mortality. So it's very important that before this happens, the treatment should be given to a particular patient. And the challenge is that most of the insurance companies in our country are not covering the treatments, both CPAP device as well as the surgery. The actual economic loss and the actual loss to the companies also by the consequences are much more than can be covered by the treatment done in the earlier stages. Because if a person lands up into a heart attack, the insurance company actually pays 10 times than the cost of the CPAP or the surgery. Or if there is a traffic accident which happens and people lose their lives and property, the loss is much more than what can be covered if the patient is treated with CPAP or surgery. So my view is that insurance companies should definitely cover the cost of CPAP device and surgeries rather than going for the cost of covering the consequences or the complications in terms of accidents and heart attacks and deaths.